for 22 years. I've worked with Dr. McCabe all of those years. He's just been such a great presence with the IBD community, and I've learned so much from him. He's always the doctor people go to when they have questions about different things with IBD, and he's a wealth of knowledge. It's just always fun to hear his stories about his travels. It's just fun. He's always doing things with his sailing, and that's always fun to hear about. I just remember when I was new, I worked with him a lot because he was always described as the patient doctor. He wasn't going to get upset if I was slow or if I didn't do things quite right. So he was always good with the new nurses.
I'm Teresa. I'm a nurse at Plymouth and I've been working with Dr. McCabe for about 1.5 years now. He is such a calming presence. Like, he's just very cool as a cucumber. Comes in, doesn't matter the situation, and he just kind of rolls with it. He's got such good one-liners, and it's things that you would never expect to come out of his mouth. We're gonna miss him a lot, probably more than he'll miss us, but just enjoy your retirement, and it is well-deserved.
My name is Amanda, and I am the manager of the clinical research department at MNGI. I have worked with Dr. McCabe for about 3 years now. Since I've worked with Dr. McCabe, I have learned so much about irritable bowel disease, about clinical research in general, the different treatment options that we have. He is honestly one of the best investigators that I've ever worked with, which is saying a lot because I've worked with a lot of investigators. One of the things that makes Dr. McCabe so great is his dedication to research and to his patients. He knows so much about his studies and he's so involved in the patient's care. He makes it a point to come by the research office just to check in, talk about how his patients are doing, talk about how we're doing as a team. The research team, we actually call him a super investigator because of how great he is to work with. And I know he's earned his retirement, but he is going to be missed so much by research. Dr. McCabe is very well known with research for coming in to the office, but every time before he actually enters the office, he knocks on the door and then he opens the door very slowly and says, "Hi, research." And as soon as we hear that quiet knock, we know it's going to be Dr. McCabe, and everybody turns from their cubicle so that they can see him walk in and start interacting with him.
My name is Amy Strange, and I'm a nurse at Plymouth. I've been able to work with Dr. McCabe for 13 years. One thing that I love about Dr. McCabe is I don't know if I've ever seen him stressed or it just seems like nothing ruffles his feathers. And so, he's always just kind of keeps that cool as a cucumber kind of presence. And this was years ago, but I was working in a procedure room with him, and we had gotten substantially behind for the day, and it was just kind of one of those afternoons where it was just everything kept compounding, so we just were getting more and more and more behind. And as we're talking, I find out he has a plane to catch. It's supposed to be early evening or something, and so I'm watching the clock, and I am internally just anxious for him. I don't think he's gonna make his flight. I mean, I think our last case, it was literally maybe a couple hours before he was supposed to be, catching his flight. Keeps on, cool as can be. I don't know, maybe he was slightly fretting inside, but he didn't show an ounce of it, and I felt more terrified for him, I think. But then the cool part with it too is, again, it was he's not the type that's just gonna rush through and, not spend the time that he needs to on his patients. I think he's really put his heart and soul into MNGI and his patients for all these years, but it's just exciting to think that he just can take some time to kind of kick back and enjoy the things that he wants to. Maybe do some more traveling and catch a flight sooner than boarding time or something.
So Dr. McCabe was at the Plymouth Clinic, which is where I'm also assigned and have worked. So for almost 3 decades, Rob and I have worked out of the same location. We've often covered the same hospitals and had the same call responsibilities and had the opportunity to share patients. When Dr. McCabe came to MNGI, he was one of our early founders, sort of the IBD focus group. Prior to that time, we had a couple of docs who spent a lot of time with Crohn's and colitis patients, but we didn't have an organized structure. And Dr. McCabe with Dr. Weinberg were able to help put that together, along with Dr. Schwartz and some others from the St. Paul group, and put together a nice specific clinic that was directed at state-of-the-art care for IBD patients. And he has been integral in that throughout his entire career. Yeah, I would thank Dr. McCabe for his leadership in a couple of areas, not only in inflammatory bowel disease, but for many years he was the director of our research department. And he also invested a lot of himself in that personally to make it successful. And we will miss those leadership skills. One of the things for those who know Dr. McCabe quite well is he's often the last person to leave the office at night. He has a lot of attention to detail. For patients that have, particularly patients that have chronic illness that need a lot of care, he always goes the extra mile, and I know that his patients will really miss him when he finally retires. Toward the end of Dr. McCabe's clinical career, he's taken up sailing, and not just as a little hobby, but really a vocation. He has, I guess you could say, he dove in head first into the waters of sailing, and now he's looking forward to potentially moving to the East Coast and being able to sail most months out of the year.